This video presents information on global tobacco control policy, highlighting the programs and policies that have been proven to stop and reduce the spread of the tobacco epidemic. Specific strategies and examples relevant to healthcare providers are covered. Although tobacco use is classified as an individual behavior, the harmful effects of tobacco extend beyond the user to affect family, friends, colleagues, and the environment around them. Compounding this complex public health issue even further are tobacco industry actions and interference with tobacco prevention and control efforts. Due to these contributing forces, tobacco use is a population-level health concern. Substantial scientific evidence demonstrates that a population-level approach to tobacco achieves large-scale declines in use. In response to the globalization of the tobacco epidemic, the World Health Organization's Framework Convention on Tobacco Control, known as the WHO FCTC, entered into force in 2005. The WHO FCTC is an evidence-based treaty that reaffirms the right of all people to the highest standard of health. Parties who have ratified the treaty cover approximately 90% of the world population. Member states that have signed the convention indicated that they will strive in good faith to ratify, accept or approve it, and show political commitment not to undermine the objectives set forth in it. The WHO FCTC serves as the foundation for global tobacco control. Both demand and supply reduction measures are included in the WHO FCTC as articles. To assist in country-level implementation of the treaty, the World Health Organization identified 6 evidence-based tobacco control measures that are the most effective in reducing tobacco use. Known as Empower, these measures correspond to the WHO FCTC articles and guidelines. These 6 proven strategies are M for monitor tobacco use and prevention policies. M is achieved by obtaining nationally representative and population-based data periodically on key indicators of tobacco use for youth and adults. P for protect people from tobacco smoke. P is achieved by having completely smoke-free environments in all indoor public spaces and workplaces, including restaurants and bars. O for offer help to quit tobacco use. O is achieved by providing adequate treatment for tobacco dependence and promoting cessation of tobacco use through a national toll-free quit line, and both nicotine replacement therapy and cessation services fully or partially cost covered. W for warn about the dangers of tobacco. W is achieved by including large pictorial health warnings on all tobacco packaging that describe the harmful effects of tobacco use on health. Rotating messages will maximize impact. E for enforce bans on tobacco advertising, promotion, and sponsorship. E is achieved by implementing and enforcing bans on all forms of tobacco advertising, promotion, and sponsorship. And R for raise taxes on tobacco products. R is achieved by increasing the price of tobacco products through higher taxes, at least 70% of the retail price, to make tobacco products less affordable. So that gives us M, P, O, W, E, and R. Empower. Brazil, Uruguay, and Turkey serve as successful Empower country examples. They have adopted comprehensive laws supported by the WHO FCTC Empower measures and thus have experienced dramatic declines in tobacco use. The experiences from these countries show that if Empower is implemented, encouraging results will be achieved. Empower measures that are most relevant to healthcare providers, but not exclusively, are strategies around P, protect people from tobacco smoke, and O, offer help to quit tobacco use. Healthcare providers are well positioned to promote smoke-free and tobacco-free environments in their hospitals and workplaces, and to encourage brief tobacco interventions as a part of routine patient care. To further support healthcare providers' role in tobacco control, the World Health Organization Code of Practice on Tobacco Control for Health Professional Organizations provides 14 ways in which healthcare associations and providers can engage in tobacco prevention and control. Some examples are: be a role model and agent for change in both your professional and personal life. Advice on cessation. Make your workplace and events smoke-free and tobacco-free. Prohibit the sale and promotion of tobacco on your premises. Influence health and educational institutions to include tobacco control in educational curriculum. And support the WHO FCTC and its implementation. In closing, tobacco control policies and interventions, as outlined in the WHO, FCTC, and Empower, have tremendous potential to save millions of lives and ensure protection of the public from the harms of tobacco use and tobacco smoke exposure. The impact of the 6 components of Empower, if implemented in each country as a comprehensive package, could transform the public's health. Healthcare providers have a crucial role in tobacco prevention and control, and their strong support has the potential to impact the future of many generations. The next video, Ready to View, will discuss smoking cessation counseling in more detail.